Hello, my name is Dr. Danya Bushwereb. I'm a consultant from medicine, and today I'm going to present borderline personality disorder. I chose it because I think it's a very important mental health problem, which can be missed and undiagnosed by some physicians. Because the symptoms of a person with borderline personality disorder can be similar to other mental health problems, such as anxiety and depression. So if you're a physician and you're listening to this video, hopefully you will benefit from it. And if you're not a physician and you know people like, for example, your friends or a family member, your partner, or even yourself experiencing these symptoms, hopefully again you will benefit from it, because that's the main reason behind opening this my YouTube channel, is to increase awareness about important things which family doctors see on a daily basis. So the agenda for today, which will be what is borderline personality disorder, and is there a stigma associated to it? Like any other mental health problem, unfortunately, there's always a stigma which people they worried if they will be labeled with the stigma of having this mental health problem, and that will prevent them from seeking help from their doctor. What's the difference between borderline personality disorder and between limerence? Because both of them can be similar, and the line is very blurred between the limerence and the borderline personality problem. How does it present among males? Because we always hear about women who have borderline personality disorder, but what about males? And why people with borderline personality disorder always end up into toxic relationships, and they always end up with a narcissistic person. So if you're living in a world when everything is either good or bad, white or black, and you always have this intense fear of being left alone, feeling empty, then you might be experiencing what is called borderline personality disorder. It is a mental health disorder. It is characterized by distorted self-image, difficulty in regulating your emotions, and difficulty in maintaining any relationships. It can affect about 1 to 2% of the population. So what does that mean? That means every 100 person you're seeing in your life, 1 to 2 out of these 100, unfortunately, might suffer from borderline personality disorder. Like any other mental health problem, there is always a spectrum. So the spectrum of borderline personality disorder can be from outbursts of anger to severe form of self-harm, such as it could be maybe overdosing or cutting themselves, or even like a suicide attempt. So as you can see here, they always worry that people will leave them. They always need like a loss of reassurance, and they always feel empty. And I'll explain the reason why. So the causes of borderline personality disorder are not really fully understood, and also because it goes hand in hand with addiction and other mental health problem like eating disorder. But the main cause, it is like childhood trauma. So that means like a person when he was a child, he was maybe emotionally or could be physically abused, any sort of abuse, and they were neglected by their parents. They didn't really have like a good childhood. And there was a trauma which happened there, and that left them feel unloved, and it left them feel empty from inside. And that's why when they grow up, because of this trauma, they always get attached to people to unavailable people. They will always get attached to toxic people, because unfortunately that's how their brain function. Because of this trauma which happened when they were little, and it wasn't really healed, and it wasn't really picked up and treated. Also, genetics can play a role, because studies show that family members who suffer from borderline personality disorder, for example, if somebody has borderline, even the sister had it, maybe the auntie had it, the parent had it, the mom had a mental health problem. But as I said, it's not really fully understood. The person with borderline personality disorder will always feel sensitive, isolated, and extremely emotional. And they will experience some symptoms such as rapid change in self-identity in a single day. They will be feeling they were feeling so happy, like they're on the top of the world, and then suddenly they will feel sad, worthless, hopeless. So they can change their they can change their identity very quickly. and they can change from one personality to another, and that's exactly where they feel dissociated and detached from his body, and then they feel there's no sense of self identity at all. And that's what we call that's the meaning of distorted self-image. So they experience a tense and unstable emotion, and that can make a person cut off friendship in a second. So every emotion they feel it's very, very intense. So if it was joy, they will feel euphoric. They will feel so happy. And if it was sadness, they will feel like depression. So that's like a roller coaster. Imagine like somebody so happy and then sad, happy, sad. That can be really exhausting. And that's exactly when a person with borderline personality disorder, they start to cut off people and they start like to withdraw, because they cannot really deal with these emotions. It's too much and it's exhausting. A normal person who had like a healthy childhood, he will not feel this way. He will not see people like black and white. The world actually is grey. Every person has some goods and a bit of evil. Hopefully the good will be better than the evil. But in the mind of a person with borderline, they cannot see this. They see like, that's good, that's bad. I'm happy, I'm not. It's very exhausting, and that's where they suddenly like, they just withdraw. Another thing also, they can experience impulsiveness. And they often feel they're misunderstood with others. And when they feel misunderstood, and from their friends, they just, as I said, they just withdraw because emotions are too much. And then they feel they don't have any self-control on themselves. And they don't have any self-control of the emotion or even the situation they're in. So they end up lashing out and end up being angry, shouting at others. And after that, they feel ashamed and they feel they regret. They say, why did I do that? And then they start, after that, harming themselves. They don't really harm others, they usually harm themselves. And that can be by overeating, it could be by like self-harm, maybe it was overdosing or hitting their heads and even like cutting themselves. I remember when I worked in psychiatry ward, I always used to see like loads of borderline personality disorder patients, female. And they usually used to say like, I only harm myself. They cut their wrists, they start hitting their head, they start doing this when they cannot control these intense emotions which they feel. They always have like, in the story, in like their history, they always have like, unfortunately, they always been abused when they were little, and they always end up into toxic relationships. They always get attached to unavailable toxic people. So a person with borderline personality disorder, as I said, they always have fear of abandonment. Why? Because they were neglected when they're a child. So even if they have a partner, unfortunately, they always like seek for reassurance. They always want their partner to tell them, I love you, like, don't worry, I'm not going to leave you. And then because they cannot control their emotions, at any moment they might like lash suddenly or accuse the partner of like anything and shout at them and then break up with them, and then not necessarily with a partner, even like with a friend or anything. And then after that, of course, they feel regret, and then they tell them, I'm so sorry, can you, like, I don't mean it. So even if they break up with that person, they will get attached to another person, an available person, or even if they have like a good friendship, unfortunately, they end up having this behavior. So all of their relationships is unstable, and they end up always pushing people away. Again, they don't do very good at school, at university. Why? Because of all of these emotions which they have. There was a study showing that 50% of adolescents who took their life and suicide, unfortunately, they suffered from borderline personality disorder, which is really sad, because it can be treated with psychotherapy. And just sometimes the person, he understands his own problem, understanding that the symptoms he's having, he's not alone. The symptoms he's having is because of a childhood trauma, and because of, it could be genetic, but it can be treated, and he will start understand himself why he's having these emotions. So I'm going to mention a few celebrities now who have borderline personality disorder. And why I mention celebrities, because celebrities are famous people people get attracted to how they look, how they wear, like for example Marilyn Monroe, her makeup and all of that. But actually, unfortunately, these people, they had like a dark side in their life, and they many of them, like, they suffered from mental health problem. But just we heard about them just because they're celebrities. I mean, I'm sure like even a lot of people like suffer from this problem, but we don't hear about them because first of all, they don't know what they have. They don't know the symptoms which they have. It could be because of childhood trauma, and also there's no like awareness about this problem. So Marilyn Monroe, she had a very, very challenging childhood. Her mom actually, she had schizophrenia. Her mom was psychotic. Her mom was admitted many times to a psychiatric ward. Marilyn Monroe, she was dumped and she was abandoned and left alone when she was only 2 weeks by her mom. So unfortunately, she ended up like with many families who adopted her, and then also like it was reported that she was abused by one of the families, and then at the end she ended up in foster care. She grew up as an orphan. After that, she became glamorous. She became famous because she was very beautiful. But unfortunately, she always suffered from anxiety, depression. The way she presented herself, it was provocative, sorry, but we don't know. It could be part of the character because she's an actor. Maybe that's how like she attracted the audience. It was reported that she had a lot of anger problems. She was manipulative, and unfortunately, she had problem with substance misuse, and she died from an overdose. Marilyn Monroe, she divorced more than once, and she had unstable relationship, and she wasn't very happy in her personal life, unfortunately. And we all know that she was the mistress of John Kennedy, the president. As I said, people with borderline personality disorder, they get attached to unavailable people. Why? Because that feeds the cycle which they have, the childhood trauma, because they didn't really had the love and the healthy relationship with their parents, and the parents left them, so they end up with getting attached to people who are not available. Other celebrities, Amy Winehouse, she died at a young age, I think in her late 20s with substance misuse. We all heard about Amber Heard and the famous court with her husband Johnny Depp. She also suffered from borderline personality disorder, and the way he like in the court when Johnny Depp was mentioning about it, he said like suddenly she gets very angry from him. She hits him, and then after that the following day she comes and sorry, I'll never do that. I love you. So all of the emotions which she has, she's feeling it very intense. And even her partner before, she had the same problem with her partner before. And even the court, they noticed that sometimes she had like some symptoms like attention-seeking behavior, yeah, she's not controlling her emotions. Charlie Sheen, although he's a comedian, also he has a dark side, and even Angelina Jolie, the same thing. Other celebrities, Jim Carrey and Robin Williams, they're very famous comedians. They make like very nice movies which made us laugh. But unfortunately also like they suffered from depression, and Robin Williams actually he suicided and he took his own life, and nobody really knew that he suffered from borderline. Nobody knew that he suffered from depression and he was suicidal and he was feeling so low. We only saw the mask. We only saw them. They put up a mask for the audience, and that's sad. Britney Spears, apart from the borderline, she also has bipolar, and she had lots of problems with her parents, and lots of problems which even affected her career. And I think this is Lindsay also, she suffers from the same problem. So Robin Williams, before he took his life, before his suicide, what did he say? He said, I think the saddest people always try the hardest to make people happy because they know what it's like to feel absolutely worthless, and they don't want anyone else to feel like that. Robin Williams. And then Jim Carrey, he said, your body needs to be depressed. It needs depressed from the character that you've been trying to play. So he feels that being depressed, actually, it's like a relief because he gets exhausted of always trying to impress others and be a comedian and make others laugh. So what's the difference between borderline personality disorder and between limerence? Limerence, what's the definition of limerence? Limerence, it means getting attached, emotional attached to unavailable people. The same like borderline, but the only difference, borderline personality disorder, again, they get attached to emotional people because, as I said, because of the cycle of childhood trauma. But borderline personality disorder, they have, as I said, like they have good, they see the world as good or bad, white or black, no gray at all. So they love you, they get attached, they idealize people, and then after that they devalue them. They see them as the horrible people in the world, and then they dump them and cut them off. So they go into this cycle. Uh, But limerists, they don't do that. They don't devalue people. They just get emotion attached again because it has the same thing. Because like when they were a child, they didn't get the love and need from the parents. They didn't really have confidence when they're children. I mean, if you're a parent and you're listening, I mean, it's very important. And even if you're doing like a very busy work, it's important after you come back from work, always give the time to your children. Always show love and give them the support. Always ask them about how you did at school, without being judgmental. Try to be friends with them. Lastly, why women, they notice that studies that women with borderline personality disorder always end up with narcissistic men. Because women, people with borderline personality disorder, they have needs which hasn't been filled when they're, as I said, when they're child. They always want, they're seeking attention. They didn't get attention when they're little. They don't feel confident. They feel empty from inside. Like Marilyn Monroe, she said that although she's the most beautiful woman and everything, that she's so attractive and beautiful, but the problem, she didn't feel that when she was a child. So they have this need which hasn't been met. But a narcissistic man, although he appears like a strong man, but also from inside he has this childhood trauma, and also he has this need that he feels weak. He doesn't feel powerful. So each one is filling in the needs of the others, and that's why they always get attracted, and that's why they always go into cycle. So what does the cycle is? The narcissistic man, he has two faces. He has the face of a very gentle man, a very loving man, giving, and then he has the other face. So the first thing he will do, he will shower her with all of the attention, and that's great for a woman with borderline personality disorder. She's an attention-seeking. She has attention-seeking behavior. She wants that attention. She wants the reassurance. So he will give her that. And when he give her that, after that, he will start to show the other face, which was an abuse. And he will put the card. He will put the card, the replacement card. I'm gonna replace you at any moment. So she will feel after that insecure. And she will feel strong emotion of anger. Then she will lashes, and then after that he will reassure her. So they will go into this cycle. So it's feeding his needs that to feel like he's in power, he's in control, because he doesn't feel that. Although from outside, you see it from outside, you think that's how he is, but actually from inside he doesn't feel that. So that's why he's using his victims are women with borderline personality disorder or vulnerable women. And for her, also, it's feeding her needs, because her needs are she wants attention, and then after that she wants the sadness, she wants to feel insecure, and then she wants to feel secure, because then it will make her it will be mimic what she had when she was a childhood, and she will have that feeling of roller coaster, and that's how a person with borderline personality disorder, that's how their brain function. The brain functions like a roller coaster, black or white. So even if a patient or a person with borderline personality, they will tell you that person is toxic, he abused. And then I remember I used to ask my patients, I used to tell them, okay, if they're toxic, why are you staying? Well, actually, they will make any excuse. And they will stay with that person. And even if they break up with them, they will get attached to another person like this. They always end up like Marilyn Monroe, she was the mistress, and I don't know, maybe in our board, they will end up like the second wife or something. Which is sad. So that's it. Hopefully, I just increase awareness about it. And if there's any questions or anything, please let them in the question area. Thank you very much for listening.